Why is taking medical help the smartest way when trying to conceive?
So it's very important that you know certain things about fertility, and taking help not just after your marriage but even before you get married is also very important in those women who are not planning to have a pregnancy straight away. Say somebody has a career in like acting, or maybe she's in a very high post and she does not want to get into a marriage straight away. Such kind of women can get their eggs stored. So in order to do that, you can consult a fertility specialist and take more information about it. And we at Arya also are doing egg freezing, so you can always contact and get yourself some help. Now, why it is important even once you get married is because you should know the time to fertility. Nowadays, couples are getting married very late, and once they get married very late, they are not able to take decisions towards starting their obstetric career or having a baby. So such couples also need a little help from the doctor. Suppose they want to create their embryos and keep it in the lab and use them whenever they require. That facility is also available with us. And not just that, if at all you have some health challenges like polycystic ovaries or thyroid or small little things like that, if you start taking action right from the beginning, when you want to have a baby, it becomes very easy for you. So that is why it's very important that you seek a doctor's help even much before you plan.
Sure. And how do we understand the fertility timeline?
So the fertility timeline is basically whenever you want to have a baby, your ovulation is the most critical part of the event, because your sperms are going to stay in the system for say 48 hours to 72 hours, and the transit time of the egg in the fallopian tube is approximately 48 hours. Means that is the overlap time for you to have physical relationships that during ovulation, and that is plus minus 7 days from the day of ovulation. So alternate day you can have relations so that you don't miss the bus for that month. So if you have to consider the timeline in the sense that how many eggs are there and what is the chance of your fertility, if you consider all those things, then it boils down to how many eggs are left in as a reserve. There are certain tests like AMH, that is anti-Mullerian hormone, which indirectly gives you an indication that you have a good reserve, or you have a normal reserve, or you have a poor reserve. Also, we do sonographies and find out how many eggs are left into your ovaries by doing the antral follicular count. So, and most important is your age. So, why it is very important? Because when the baby is inside the uterus, like if the female fetus in the mother's womb, the maximum number of eggs that are there is 7 million. And even in the mother's womb, the degeneration of these follicles, or so-called the oocytes, happens right from the time the fetus is inside the womb, and at the time of delivery she has just 1 million left. By the time she starts her menarche, around 3 lakh, and there are just 450 cycles that that happen in a woman's entire life, and that boils down just to ovulation of around 450 eggs. So a few thousands may be left by the time you are actually ready for pregnancy. So you need to catch the bus in time, and that is why it's very important.
And how does early evaluation help in this case?
Because once you evaluate how your egg quality is, and your that is the age basically. So less than 30 years you are having a fair chance or a good chance of conceiving. But as you start aging, like more than 30 years of age, then slowly the fertility starts dropping, and it rapidly deteriorates after the age of 35. So internationally, even if you consider 35, our women more than 30 also are at a risk of facing infertility issues. So that important it is. And after the age of 40, it becomes very less common for you to get pregnant. That is, the chances of an actual pregnancy are less than 5%. So even in IVF cycles, we do not get a very good success rate after the age of 45. That is why it's very important for you. You have a very short margin. Like nowadays, women are getting married post 30. So it's very important for everyone to understand fertility cycle.
And what exactly happens in a fertility consultation?
So basically what we do is we evaluate the patient completely, apart from giving them a proper healthy diet, then making them understand of the fertile time where they can have intercourse so that they have higher chances of pregnancy. But also we have to see whether they have any sort of polycystic ovaries, so that we have to counsel the patient accordingly for ovulation. So we assess the ovulation, we also assess the fallopian tube patency. Of course, the functionality is only affirmed when the patient gets pregnant. Also, we have a wonderful system today, 3D sonographies, 3D, 4D sonographies, where we do sonographies and see whether there's any organic obstruction in the fertility aspect. There may be fibroids, there may be adhesions, there may be endometritis, or there may be some unknown factors which are causing infertility. So all those factors we assess. Of course, we do a per speculum examination, see if there's any local infection like a vaginal infection or a cervical, that is the mouth of the uterus is infected. So all these small little things we evaluate. Whether there's any thyroid issues, because even thyroid issues can cause infertility. There is something called prolactin hormone which may be a little high, and that also can cause irregular cycles, which can be a cause for infertility. So these are the common factors. Of course, there are many uncommon ones which can cause recurrent implantation failures, or maybe there are failed conceptions. So there are many special tests which we also conduct for those who are having more challenges with failed cycles.
What would you say are the final 3 takeaways for someone trying to conceive?
So the final takeaways are that you should know your age to fertility is number 1, and you have to seek a doctor's help and in time, and that is number 2. And of course, get your eggs or your embryos frozen in time, so that whenever you want, you can plan your pregnancy at your timeline. So these are important things.
That sums it up. Thank you, doctor.
Thank you.